Hi everyone, my name is Dr. Sudhir Kalaskar. I am a fellowship trained colorectal surgeon and a board certified general surgeon. I work at Advent Health 8 City and Zephyr Hills. I'm here to talk to you about fecal incontinence and what is it and how do we treat it. So I'm just going to discuss briefly about what fecal incontinence is, followed by just give you a little idea about the anatomy and how the rectal canal and anal canal works. Also, I'm going to give you a little idea about the problem, the issue that's going on in this country with the fecal incontinence, and then we'll talk about the treatment modalities briefly. I'm going to specifically focus on sacral nerve modulation. Fecal incontinence is inability to control the bowel movements, including or leading to leakage and seepage of stools from your rectum. Also included in this condition is or inability to resist the urge when you need to go to the bathroom. Also planning your social life around the bathroom, monitoring what you eat, and use pads and protective garments. It is not normal, and it is not a normal part of aging as well, as many people think. It is treatable. Before we go ahead with the actual methods of treating this condition, we need to know a little bit about anatomy and physiology of the rectum and anal canal. As you can see here, rectum is made up of muscles, nerves, and blood vessels. And there are two important muscles that we need to remember, the external and the internal sphincters. These muscles hold your stool, and these are the muscles that are responsible for your continence. So the ability to hold stools require a synchrony between the muscles of the rectum, anal canal, and your nervous system. Normal continence is the ability to sense the presence of stool in your rectum and the ability to relax and evacuate your stool. Fecal incontinence results when this balance or the ability to hold or sense the presence of stool is lost. Trauma, aging, radiation, long-standing diabetes, stroke, and history of rectal prolapse can lead to fecal incontinence. The most common cause of fecal incontinence in this country is obstetric injuries, and hence fecal incontinence is most commonly seen in women. Also, fecal incontinence may be more prevalent than you think. 1 in 12 Americans are affected with this condition, which is about 20 million people. Many are suffering in silence, and the reason for that is there is a lot of shame to come forward in describing this condition to their physicians. As you can see in this slide, we have millions of people who suffer from conditions that are commonly known, like diabetes, hypertension, whereas fecal incontinence is not talked about. And as you can see in the next slide here, fecal incontinence is actually a big problem. It is only next after diabetes as per this chart. And also there is another condition that overlaps fecal incontinence, and it's called overactive bladder, where you suffer from urinary urgency and also urinary leakage requiring to wear pads. Okay. If you suffer from urinary incontinence, there is a chance that you may also be suffering from fecal incontinence. Now, patients with this condition are undertreated. There is a lot of, as I mentioned before, there's a lot of shame and embarrassment, and there is a stigma associated with this condition that keeps the patients from talking about it. In fact, many people wait a long time before they talk to their provider about this condition. The health impact of fecal incontinence is enormous and serious. your patient may be in severe distress, and the quality of life is often very poor. It has been reported that some patients think this condition is worse than death. Treating this condition is extremely important and it matters. How do we treat fecal incontinence? There are two main modalities. One is conservative management, which is non-invasive or non-operative management. The second one would be to do some kind of an operative intervention or a surgery. So as far as non-operative management or conservative management is concerned, we have number one is medications. The medications basically bulk your stool. We give stuff to bulk your stool. When your stool is hard, the leakage rates are lower and your fecal incontinence is controlled. The second method is dietary modifications. We recommend to avoid certain food that causes fecal incontinence. The third method is by pelvic floor exercises. A lot of our patients are elderly and they have weak sphincters which lead to fecal incontinence. We send these kind of patients to pelvic floor therapy where exercises are administered to improve the tone and the strength of the sphincter muscles that can help to alleviate the fecal incontinence. The last method in non-operative management is called biofeedback therapy, where the brain is kind of retrained to sense the presence of stool, and you go to bathroom after this training in a particular time so you don't have fecal incontinence. In conditions where the fecal incontinence is as a result of tear of the sphincters, there is a possibility of doing an operative intervention and repairing those sphincters. However, in the last decade, we have noticed emergence of a new treatment modality which is slowly replacing the surgical repair or sphincteroplasty. This is called as sacral neuromodulation, or also called as InterStim. So multiple studies have been done, and these have confirmed the effectiveness of this treatment modality in controlling the fecal incontinence. I'll briefly talk about sacral neuromodulation by InterStim technology. What is neuromodulation? Basically, sacral neuromodulation acts to provide a small amount of electrical stimulation to the nerves that run through the sacrum or the tailbone, and they stimulate the nerves that supply the rectum and the bladder. For reasons we do not well understand, this improves the fecal incontinence as well as urinary incontinence. So a lot of people have questions about electrical stimulation. What is it done? How is it done? Basically, the whole idea of stimulating these nerves is by placing a lead into your back and stimulating these nerves with a stimulator. So neuromodulation or InterStim placement basically has two steps. The first step is the initial evaluation, where you come to the office and we place what is called as a temporary lead, and this is left in place for 7 days, and we measure your symptoms. Basically, we give you a diary to go home with, and you record your episodes of fecal incontinence after placement of this lead. So once you come back to the office after 7 days, you bring your diary back and we look at the fecal incontinence score, which means that we look at how your fecal incontinence has improved or same after we place this test lead. If your symptoms, even one of your symptoms have improved, more than 50%, then we will go ahead and place a permanent lead. This will be done in an operating room, and you'll be sedated but still awake, and we will place the lead and test your nerves and see how they are reacting. There are certain ways we do these tests, and once we confirm that the lead is in correct place, we go ahead and place the generator as well as the battery. The neuromodulation has great results. So it actually helps the people who are suffering from chronic fecal incontinence, and as I mentioned, the results are impressive. So there is an 89% clinical success rate at 5 years. In fact, 36% of the patients have reported that their fecal incontinence has been completely resolved. Numerous studies have shown that the quality of life greatly improves after placement of this sacral neuromodulation. So, sacral neuromodulation for bowel control is delivered by intestine system, and it has demonstrated superior efficacy to medications. Also, it is being recommended by societies such as American College of Gastroenterology as well as American Society of Colon and Rectal Surgeons. So the other important point that we have to remember about this technique or this procedure is that the evaluation gives every patient a simple way to find out if the therapy is right for them, even before they get a permanent lead, which means that you have 7 days to assess your symptoms, and if you think that it's not working, we don't have to do the final lead placement. So all in all, we have hope, and with fecal incontinence, you don't have to suffer. You can talk to your primary care doctor today if you're suffering from this condition, and they would refer you for further management, and we can do an assessment and take care of your problem.
Thank you for joining us for this Advent Health virtual seminar. Please be sure to leave a comment below if you have any questions. If you would like to schedule an appointment, please give us a call.